Well, as we continue our tour, of course, we have some memorabilia on the wall here. This is John Ford. He's a very famous race car driver. They're all patients, and I'm here in the winner's circles with them, and I had absolutely nothing to do with winning. And we continue into room 2. A similar decoration, pneumatic table. The tables are phenomenal. And I was a chiropractor. Actually, I'm still a chiropractor, but I did it for 30 years, and I found out that there are better ways to do things. I'll give you an example. This is a pneumatic table. It makes a lot of noise. Watch out for it. Moves up, and when we move the vertebra, it lightly goes in. It's like moving the tablecloth away from a place on a table, so it moves very quickly, and there's no stress. This is some of our artwork. This is something that had done for me, a famous artist. I had nothing to do with it. It was a beautiful, beautiful artwork. Her name was Pat Leach, and it's one of our favorite pieces in the office. Continue into the office. See a little bit of me again. We have our, we call reported findings room. This is where we do all our discussion. Examples of the spines and the bodies. We have something really kind of neat over here. This is our system that tells people or instructs people if they have a pinched nerve here that it will go into the head, and if they have the neck, you know, how people get arm pain, how that same nerve goes to the lung, or that same nerve can go to the heart. So it's really important. People need to know how their body works. For instance, people have lower back pain, you know, they have pain down the leg. That same nerve goes to all the important things in the pelvic area, things that want to make things better. So it's quite important. This is, again, one of our computers. It has also different programs on there to educate and instruct people in how to take care of their body. Continuing into my office. This is something new that I've added. It's a massage room. We have a masseuse that comes in here, and people seem to enjoy it. They like to get a full massage. I don't know how much money it is. I don't think it's covered by insurance, but they still willing to pay for it. And again, this is one of my other treating rooms, room 4. They're all the same. We try to make them consistent, so you know I always know exactly where I'm at. Okay. This is our X-ray room. A lot of the new chiropractors coming out are not getting X-ray because they cost a lot of money. When I was a young doctor, they still cost a lot of money, but I was able to buy one. It's a very good unit, takes very good pictures. And we continue down the hallway. And again, a lot of pictures. I like color. It makes everything better. We had a bit of a leak in the office here. This is our famous bathroom. There is one reason I did want to show you that. I put in the bathroom, and we put a educational camera. And people said, why'd you do that? Because it sounded like fun. No other real reason. So we'll continue now in a few minutes, about 45 minutes. I will be going over my first educational program, and it'll be why my silly back never gets better. It's an interesting program because we're going to be covering the iliopsoas system, and everybody says, what? But everybody knows it. One of the things that's interesting is that when everybody has a bad back, they're always bent over. And they always think my back's spasm. But if the back really was a spasm, they would go backwards. So there's a misnomer, and we're going to educate people on why this is occurring. But most of all, this one program is for my daughter in Cincinnati, Ohio. And one of her children continually has iliopsoas problems. And so we're going to go over there and show her how to help me take care of it, and maybe visit once a week with her, even though I won't be seeing her. So we'll see you in a little bit, and we're going to shut down until we start the afternoon program. So